My philosophy of care is to help a patient from start to finish. I want to address all the patient's issues to my best ability. Focusing on just one subspecialty when the patient is a human with all sorts of different issues going on can be very problematic. It makes care disjointed. And so I try to at least help facilitate patient care in other aspects of the care as much as I can. I'm not saying I'm a specialist in every domain of medicine. My goal would be to get patients to the right place so they could get the care they need. So one of the best things about my practice is that my office is basically within the hospital. I'm right above the emergency room. So when there's an acute stroke patient in the ER, it's very easy for me to come down, see the patient, care for them. And I'm a big advocate for continuity of care. So if a patient is seen in my hospital, I expect to see the patient and follow up so that they're not lost after they leave the hospital. Patients are often bombarded with so much information in the hospital, it can be a little overwhelming. And so that follow-up is so important to be able to emphasize the important things so that they don't come to the emergency room again. My favorite aspect of care is communicating with my patients. I don't like big words. I try to keep things so simple so that we both understand each other. Using medical jargon is often not necessary. I think it's more important that patients understand what they need to do to stay healthy. And that's the key thing for me. So that communication is very important because that can change a patient's life. And I think doctors can forget how powerful their words can be. My goal is to help patients adjust their lifestyle so that they don't have to keep seeing me. The trust from my patients comes from my modesty. I don't have a big ego. I don't walk into a patient room with a big ego. I come in as a person with knowledge. And I work with the patient to make a decision together. I think as a physician, our role is to provide a brief education to patients to allow them to make the decision that they feel is best for them with our guidance. And I think that maintains a very good, trustworthy relationship with families and patients. And it gives them an environment where they feel comfortable to ask me questions. And I think creating that environment is very important because then you can solve problems together.